Hello and welcome everyone. My name is Jessica Blaustein and I'm the Senior Director of the Healthcare Partnerships team at the Muscular Dystrophy Association. Thank you for joining us today for an MDA Industry Update webinar sponsored by Accredo. Accredo by Evernorth is a nationwide specialty pharmacy providing care for patients with complex or chronic conditions. Today, 3 esteemed panelists will share information about Accredo's patient-centric approach to rare conditions. On behalf of MDA, we'd also like to thank both our speakers and our audience for all that you do for MDA and for the neuromuscular community. MDA's industry update webinars provide an opportunity for the medical community to receive information and updates impacting care and treatment directly from biopharma companies and others directly involved in the neuromuscular space. These webinars are just part of MDA's medical education resources. We encourage you to visit the medical education pages of mda.org. There you'll find educational resources on a wide range of relevant topics about care and research in neuromuscular disease. Now, I'd like to introduce our presenters for today's webinar. First, we'll have Elsa Chakute, PharmD Senior Product Manager, Jared Doherty, PharmD Senior Clinical Advisor, and Noelle Van Buren, Operations Senior Manager. Without further ado, I'd like to turn it over to Elsa. Thank you.
Thank you, Jessica, for the introduction. Before we get started, I would like to thank the MDA for this opportunity to present this content to the Industry Update webinar. I also want to extend my thanks and gratitude to everyone attending the session today. I'm very excited to discuss Accredo's patient-centric approach to rare conditions, focusing on the rare neuromuscular conditions. Today, we will give you an overview of Accredo's Rare Disease Therapeutic Resource Center and the referral journey at Accredo. We will also discuss our engagement in the rare neuromuscular community. We will take questions at the end of the presentation. We will appreciate it if you can please put your questions in the Q&A chat box. Starting with who we are, Accredo by Evernorth is a full-service, nationwide specialty pharmacy providing care, service, and support for patients with complex and chronic conditions, such as multiple sclerosis, rare conditions, and bleeding disorders. At Accredo, we place patients at the center of all we do, and we have a dedicated team to support you and your patients. Accredo has what we call therapeutic resource centers, or TRCs, which are really our clinical capabilities and expertise. We have 15 condition-specific therapeutic resource centers. We deliver individualized attention and provide condition-specific support to meet patients' and prescribers' needs. We understand that a patient living with hemophilia, for example, we have different needs than a patient living with spinal muscular atrophy. Today, we'll give you an overview of the Rare Disease Therapeutic Resource Center, which provides a high level of expertise and personalized care to patients with rare and ultra-rare conditions, such as spinal muscular atrophy and Duchenne muscular dystrophy. I will pass it over to Jared to discuss what makes Accredo's Rare Disease TRC unique.
Thank you so much, Elsa. I really appreciate it. I'm happy to be here today. So I'm actually going to start on the right-hand side of the slide and work my way left. I know that's a little backwards, but I think it makes more sense that way. So looking at the Rare Disease Therapeutic Resource Center, or TRC, we are Accredo. We are a large company, but within the rare TRC, we're a very small group that's very dedicated specifically to rare diseases. Even beyond rare disease, as a larger overarching TRC, we have dedicated sub-teams. So I'm specifically a neuromuscular sub-team whose only goal while they're working is taking care of those patients who have neuromuscular diseases such as spinal muscular atrophy or Duchenne's muscular dystrophy. Alongside our clinical team and care team is a patient access team. Therapies are only as good as the patients who take them or receive them. So without patient access, without the ability for reimbursement, without the ability for insurances to cover those therapies for our patients, that's a big barrier. And our team, specifically with gene therapy, is very specialized. They're very experienced. They've been around since the launch of commercial gene therapies back in 2017, and they're really good at turnaround times and speed to therapy are their major focus. My first MDA conference, I heard a quote, and I think it stuck with me in everything we do at Accredo, but it's time is neurons. I think that makes a lot of sense when you're thinking of diseases like SMA, and the quicker we can start therapy, the better. And the last on the right-hand side is we're super active in the rare disease community. Beyond just hosting this webinar today with MDA, we do attend a lot of other both patient and healthcare-driven events, whether it's walk and roll, whether it's any other local activity, national conferences, et cetera. We are proud to partner with all of you, as well as those patient advocacy organizations to drive progress and better outcomes in our patients. Flipping over to the disease-specific clinical side. So within the rare TRC, we do handle 30, actually more than 30 rare and orphan therapies as approved by the FDA or designated based on patient population. On top of that, we did launch the first 2 commercial gene therapies. I briefly touched on that with our patient access, but I mentioned that because we were there from the start. We were there from when no one really knew how to commercially handle, from even prescribing to acquiring, distribution, shipping, packaging. How does the pharmacy store it if they're going to store it in super cold, ultra cold freezers, et cetera. We've been there. We've had some growing pains along with the market, and we've adapted and really, driven to be a leader in gene therapy. Additionally, I mentioned that we're a super small team. We really are a small number of pharmacists. However, on average, we're over 4,000 clinical education and interventions on a quarterly basis, which is massive. These are some of the most fragile patients and that we have the privilege of serving. And, we have the luxury of having pharmacists like myself that not only review new therapies and create clinical programs that meet these unique needs of these patients, but we get to also then review over time how these interventions on a quarterly, annual basis add value or potentially identify opportunities that we can, create an even better patient experience for our rare disease and neuromuscular patients. You want to go to the next slide, Elsa? Thank you. So going a little bit further into our rare TRC, we are one of a very small number of pharmacies that have obtained the UREC Rare Disease Pharmacy Center of Excellence certification. What that really means is that it really signifies our ongoing commitment to high quality, condition-specific care, and specifically rare disease care. There's 4 main pillars to the rare disease COE, or Center of Excellence. First and foremost is multidisciplinary assessments and education. So that's kind of a multifactorial approach here. First and foremost, all of our staff receive education on an annual, quarterly, regular basis, whether it's because new data comes out about a drug, whether it's because the package insert is updated, maybe it might be a guideline update. But all of our staff from top to bottom receive that every year. It's all very focused and driven on disease states, barriers, and outcomes. We also focus on tailored experiences and outcomes. So I'm going to say it again, we are part of a larger Accredo organization, but we're a very, very small, very focused and driven TRC, and focused on providing that individualized patient experience from the beginning of their therapy journey, and staying with them through as long as they're being serviced by Accredo, or as long as we have the privilege to take care of them. Along with that, we do subspecialize a little bit. So our neuromuscular pharmacists and nurses, dietitians, clinical teams only work with neuromuscular patients. Their training is focused on neuromuscular diseases, and day in and day out interacting with those patients, caregivers, providers, to really build a relationship with those patients and also be a point of contact for any clinical concerns that may come up throughout their therapy journey. And lastly, I'd be remiss to not mention our engagement strategy, and that's not just engaging with other pharmacies or even pharma as a whole. That's engaging with anyone who's involved in that patient's care team, and really taking a collaborative approach to patient care. We can only be as good of a pharmacy as the information we have, and the more information we share with you all, the more information we receive from the patient, the more involved we are in getting them their therapy as quick as possible, the better. To really drive the four things at the bottom here: the very high quality health services, enhancing processes, improving patient outcomes, and most importantly, patient safety. We always want to make sure what we're doing is in the best interest of the patient and strive to make sure they're having the best possible outcome on their respective therapy. So while we're on the topic of therapy, also, if you want to go to the next slide, the neuromuscular therapies we have access to at Accredo and are dispensing as of today, May 31st. Looking at spinal muscular atrophy, we are the only pharmacy in the country that has access to every SMA therapy. I don't say that to brag, I promise. I bring that up because it really allows us to be kind of a coordinator of care at any time with the growing push for dual therapy and SMA or gene therapy plus either of the SMN2 promoting therapies. There's really, between medical and pharmacy benefits, as an example, they don't always talk to each other. But as the pharmacy that has both of them, there's a good chance we've seen that patient before. And there's a good chance we know that patient, that provider, that payer, and we have existing relationships with those respective organizations, which again really helps us to drive efficient, effective, and high quality patient care for those SMA patients. For Duchenne muscular dystrophy, we do have the only gene therapy that's on the market for Duchenne's muscular dystrophy, which is Elevidys. We also have Emflaza and Deflazacort, which is the generic of Emflaza as well. All right, and so let's go just a little bit further into our team structure. So I've talked about how we're a small team, how we're really focused. What does that really look like? Well, on the right-hand side, just some pictures here of our actual staff members, some of our staff members and colleagues. The point of this slide, the right-hand side, is really just showing how we have a well-rounded and diverse group of individuals on our team that exists to provide a very high-quality patient experience. So what does that mean? I touched on it earlier a little bit. All of our team members are specialty trained on rare neuromuscular conditions and patient-centric programs. So that covers everything from the clinical side to the non-clinical barriers of these neuromuscular diseases, the social and mental burden of chronic illness, and especially rare disease. That's looking at onboarding and navigating barriers to access. So that could be anything from financial, that could be transportation, that could be any sort of social determinant of health-based process. We actually have social workers and dietitians that work on our team. They're not contracted out. They're employed by and work directly with the Accredo rare disease team, and specifically the neuromuscular sub-team within that group. And they are full-time employees. They're not external. They're here working with us day in and day out to really help drive those processes and help our patients. I kind of touched on coordination of care already with not only having access to all the therapies, but how closely we all work together. We're a very close-knit team. There's not a day that doesn't go by where I don't talk to Elsa and Noel, let alone the rest of the rare team. The clinical education is very robust and significantly more complex than what we may see in say a non-specialty or non-rare disease state. As well as our field nursing support. We do employ about 600 nurses across the country that are also directly employed by Accredo and not contracted out to assist with any of those potential. I know at the moment those therapies we have access to are not necessarily given in the home via IV, but the pipeline specifically for SMA, but also for Duchenne's definitely has the potential for some home infusion or home nursing or field nursing type support. And we are more than ready to support that. And then I touched on it a little bit, but I really want to drive home. The social worker and dietitian support is huge. Having them on our team makes it incredibly effective and easy to provide that care in a rapid manner and in a proactive manner. It's not necessarily just reactive when we notice something, but they're going out there and proactively interacting with their patients or caregivers and making sure that they know that even if they don't need support now, they exist and they're here and ready to help at whenever they need it, whether it's now or a year from now. And with that, I believe I'm going to turn it over to Noelle.
You are. Thank you, Jared. So another important element of our care model involves the support that we offer you, our prescribers, and we do that in several ways. So I lead a dedicated prescriber team that offers collaborative support and provides real-time information on things like the status of patient orders and new referrals. This team is your one-stop shop as they provide immediate and complete resolution for any issues that you may face. Additionally, they offer assistance with registration and navigation of our My Accredo Patients portal. This is a web-based prescriber portal that helps keep you informed by sharing real-time insights on things like prescription status, authorization updates, and shipment information. The portal also includes a chat function that will connect you with a live agent from the prescriber support team should you need assistance. We also know that navigating prior authorizations can be challenging at times. So Accredo is staffed with a team of representatives that have a strong understanding of the payer landscape, of the approval guidelines, and also any required clinical documentation that's needed to gain approval for your patient's drugs. And then our clinical care management programs educate our patients, identify and remove barriers to care, and promote positive outcomes. We provide patients with proactive, personalized care to help improve adherence to the drugs that you prescribe, while optimizing health outcomes and reducing unnecessary drug and medical costs, such as emergency room visits. Within our therapeutic resource centers, our specialty care management programs provide disease-focused clinical interventions by specialized clinicians, including things like individualized patient assessments, proactive adherence support, outcomes tracking, detailed reporting, and just support for the prescriber-patient relationships and plan of care. Our teams also work hand in hand with patients to identify financial gaps and assist in enrollment in any available financial assistance programs as they're needed. And we also understand that the specialty pharmacy is just a small piece of the road that your patients have to navigate. So with your guidance and partnership, we work to provide whole person support for patients that are living with a rare disease. That may look like support from a social worker. Jared touched a bit on the social workers and dietitians. So guidance towards any clinical or financial or community-based resources, and then assistance navigating just the emotions and grief of a chronic condition. Accredo is also staffed with both nurses and pharmacists 24 hours a day and 7 days a week to provide immediate support for patients and for you as you need them. And in most cases, Accredo shipments are delivered next day, either to your office or to the patient's location of choice. And I think from here, Elsa, if you'll go to the next slide, we'll take a look at the journey of a new referral as we receive it into the pharmacy. Before we get started, if you look to the top right of your screen, you're going to see 3 indicators. The green indicates an action that's taken by Accredo. The blue indicates engagement with you, our prescriber, and the red indicates engagement with the patient. So when a prescription is received for a neuromuscular patient, our patient access team begins a benefit investigation. During this step, we're going to verify the patient's medical and pharmacy insurance benefits. As a prescriber, you can monitor this step using the prescriber portal at myaccredopatients.com. Spoke about that a little bit earlier. Almost all of the medications dispensed through Accredo require prior authorization. So in the next step, our team assists in submitting prior authorization requests. Again, this team works with a really deep understanding of those clinical requirements and the payer landscape. So they're experts at navigating that path to approval. And if needed, they can also provide support for PA appeals. As this is happening, an Accredo pharmacist is reviewing that prescription for clinical completeness and just to make sure that there aren't any potential drug interactions. From there, the patient is going to receive a call from an Accredo patient care advocate. During this call, the PCA is going to set the tone for future interactions and give the patient just an understanding of what they can expect as they're on service with Accredo. They're going to review things like the patient demographics, communication preferences, including our digital tools, so text, web, and app. They're going to arrange delivery of the prescribed medication to the patient's requested location, or they will obtain the patient's consent to schedule that delivery to your office. From there, if a financial gap is identified, we're going to assist the patient in identifying and enrolling in an available financial assistance program. Depending on eligibility, that could either be a manufacturer-sponsored assistance program or a government-funded foundation. And then lastly, a neuromuscular trained clinician is going to provide comprehensive drug-specific education or counseling to the patient prior to that medication being delivered to the prescriber's office, to your office, or to the patient's location of choice. And then overlooking the entire referral journey is a designated program manager. Their function is to monitor the progress of that referral from start to finish, and they're looking to proactively identify any gaps and work back with the teams that are processing that referral as needed, just to ensure that the referral journey is smooth and that your patient gets medication as quickly as possible. And that's really a look at the journey of a specialty neuromuscular referral. And so with that, I will turn it back over to Elsa.
Thank you, Noelle. We could not conclude this presentation without talking about Accredo's engagement and support of the rare neuromuscular community, which for me is one of the most rewarding aspects about working for Accredo's rare disease TRC. I know Jared touched on it at the beginning of the presentation. We are very active in the rare community. We support and engage with several DMD and SMA patient advocacy organizations. Starting with MDA, we sponsored and attended their annual clinical conference in March, where we had the opportunity to speak with many rare neuromuscular prescribers and learn about how we can better support them. With Cure SMA, we have participated at several Cure SMA walk and roll events, as seen here on the second picture on the slide, raising money for SMA families. We are also sponsoring and attending the Cure SMA annual conference coming up in a week. As you can see the picture, the first picture here, that was at the last Cure SMA annual conference in Orlando. We are always very excited to meet hundreds of our SMA families, and we're really looking forward to meeting them again in a week or so. We are also engaged with the Parent Project Muscular Dystrophy and also attending the annual conference at the end of June. I'm very excited and looking forward to meeting with a lot of the Duchenne muscular dystrophy families and also clinicians as well. Following here with the JET Foundation, we are excited to be part of the JET Foundation World Duchenne Awareness Day celebration, which is on September 7th. The JET Foundation provides support to a lot of DMD patients and families. We are very thankful to be part of this amazing community, and we are very proud to service you and care for your rare neuromuscular patients. This concludes our presentation. Thank you so much for your time and attention today. Please visit our website, accredo.com/rare therapies, to get more information about how we support rare prescribers and patients. I believe we have a few minutes left or questions? Let's check the Q&A chat box and see if we have any questions.
Elsa, I think there was just one question here in the chat box. Are there plans to bring ALS into the rare TRC NMD service line?
Thank you for your questions. I think that's something we're always looking at internally, depending on the needs of the patients and the needs of the prescribers, to see where each therapy will better fit within which TRC. I know, Jared, you're also very involved with the clinical placement of some of the therapies. I don't know if you have anything to add regarding bringing ALS to the rare disease TRC.
No, I think you hit that one on the head.
Thank you. Any other questions? All right, I think we have a quiet group here. It's Friday afternoon, so I know most people are ready for the weekend. And thank you again. Thank you everyone for attending the Industry Update webinar. And I also want to thank the MDA again, and thank you, Jessica and Tanya, for the partnership. We really appreciate it. Thank you.
Thank you so much to Accredo, to Elsa, Noelle, and Jared. That was a very informative and insightful presentation, and we're very grateful for your time, and also for the time of all of the medical professionals who have taken this moment out of their day to join us and to learn. So thanks very much. Enjoy your Friday and have a nice weekend coming up. Please visit mda.org for more educational information in the future. Thanks.
Thank you.
Thank you.